estimates of D is, best estimate today is we need 1,000 units for every 25 to 30 pounds of body weight. So
For
most-
every pound?
For every
25
25 to 30 pounds of body weight.
30.
So every 100 pounds probably needs 4,000 units as a maintenance. But when you're in needing to be in a recovery mode, having issues out of balance, I take 10,000 units a day because I'm indoors all the time. I'm trying to make sure my blood levels are above 80. Above 80 is steady state activity.
So for recovery, it would be
If you're
how many for
If you're-
100 pounds?
Yeah, if you, I don't know what absolute, I just say we boost it up, and so I would say you would need somewhere between, in fact, if you're that low, and I think on some one of the things about 200 pounds, I would say probably want 15,000 every morning for about 3 weeks, and then 10,000 every morning until you know that your levels are up around 80. If someone's recheck testing and if you're at 120, no big deal, there's no known toxicity with D3. There are actually studies showing reversal of autistic tendencies by taking blood levels above 150. So,
Because my kids have a social pragmatic communication disorder, which kind of, I don't know, an ADHD kind of, and maybe autistic like.
sometimes labeled on the spectrum because they've got a long range of things, so
Yeah.
on the spectrum.
Yeah.
And it's been shown, and not necessarily mainstream accepted, it's been shown that the likelihood of developing something on the spectrum increases the lower the vitamin D levels in the mom during the pregnancy. All kind of correlations with that. But initially, all we saw was case studies with children on the spectrum where they took their blood levels above 150 and saw reversal. But I saw a study recently that was done. The average age of the child was 7.5, something like that. The average dose was being used was over 8,000 units, where they were seeing reversal of significant improvement in their responses. So there is some stuff. I think that's trying to isolate one variable. And I think there are a lot of other pieces in that mix, and I'm not trying to blame everything on vitamin D, but it certainly is a factor.
So you didn't write this down. It was 15,000 for 3 weeks, and then down to 10,000.
Oh, for 3 weeks.
You just kind of load it to start with.
10,000.
But your goal, if someone's doing blood levels, and you can get those on your own if you need to, but your goal in doing blood levels is to try to get up around 80 and keep it around 80 from my perspective.
She'll test it at 80. Okay.
So antibodies are present, but in the range they consider normal, whatever that means. I'm not sure probably should have any, if this is a marker of something that attacks your own tissue.
So hold on, just going back to, I just noticed this. You were saying for every 100 pounds you need 4,000 units, but then you're saying for kids as maintenance. But for kids you want 8,000.
No, that was a study on children with significant autism. They were using that. Okay.
Significant autism.
Yeah, my granddaughters, when they hit about 3 or 4 months old, I started 1,000 because when they got up in when they were in that 25 pounds or so range, I started them then.
So for like a 65-pound kid,
2,000 units.
and for a
If they're living outdoors all the summertime, 1,000 in the summertime and 2,000 in the winter. Because you're making some all the time. If we're out, we're not at equatorial intensity. There's all kind of other factors, but.
yeah, we put sunscreen on them though, so 2,000.
So your fasting insulin, even with your treatment, the range is from 2.6 to 24.9. You're at 22.7. So your fasting insulin is way up here. Blocking thyroid receptors. That should be. I've seen markers that said with that range that it should be around 6 or less. Ferritin is not as bad as I thought it might be. The ferritin is on here, 15 to 150. So optimal is somewhere around 75 to 120 or something like that. You're at 65. So this lab, she printed when it came out. We need to Xerox that.
Yeah.
So I have a copy, you have a copy. This original is yours. I have a copy in my file of the saliva panel. I just need to Xerox that. Questions in this process so far? I've been throwing lots of stuff out, and as we went along looking at bits and pieces.
Well, I guess the question is, where do we go from here? What's the recommendations?
We used the same model too. We probably looked at this before.
Yeah.